Hello, this is a sagittal section of the brain, and we're looking here at the corpus callosum. This is the cerebellum, the pons, and the medulla. And over here is the region of the base of the brain. Let me just quickly rotate this to orientate you. And again, here we can see the cerebellum. The main pathology lies in this region in the base of the brain. And I'm just going to magnify this area. We can see some blood vessels here, which are likely to be from the circle of Willis. And this is the main area of abnormality, which is a saccular outpouching from one of the vessels. This is an example of a berry aneurysm. And what we're looking at here is the cross-section of the berry itself, or the saccular outpouching. And we can note that there are some dark areas which represent blood, but there are also these pale areas which are likely to represent fibrin. Hence, there has been thrombosis within this berry aneurysm. One of the main complications of berry aneurysms is that they can give rise to hemorrhage because of the marked thinning of the vessel walls, which make them prone to rupture. Berry aneurysms arise from structural abnormalities in the walls of the arteries, and they most often occur in the region of the circle of Willis. So there is a defective smooth muscle layer as well as intimal elastic laminar layers, and therefore this gives rise to outpouching of the arterial wall, and this abnormal area is very thin-walled. The epidemiology of berry aneurysms is quite interesting because they may be associated with some underlying genetic disorders such as autosomal dominant polycystic kidney disease, some connective tissue disorders, and neurofibromatosis as well. And they also may be associated with other vascular abnormalities such as aortic coarctation, fibromuscular dysplasia of extracranial arteries. They tend to occur at the bifurcation points of arteries. Clinically, if there is bleeding, this will give rise to spontaneous subarachnoid hemorrhage. As you can see in this picture, there is a berry aneurysm here with associated bleeding over the surface of the brain. Sometimes this hemorrhage can also track into the cerebral parenchyma, leading to intracerebral hemorrhage. So, of course, this can give rise to neurological deficits as well as raised intracranial pressure. What sometimes precipitates the bleeding is a moment where there is raised intracranial pressure, for example, when the patient is straining at stool, and then they can experience a very sudden, excruciating, extremely painful headache known as a thunderclap headache. There may also be symptoms of meningeal irritation, such as neck stiffness, and also these patients may experience seizures or neurological defects depending on where the bleed is. You may also refer to the talking pot of the specimen of the dissected circle of Willis, where you can very clearly see berry aneurysms, and also the specimen showing the berry aneurysm and associated subarachnoid hemorrhage. In summary, we have here a sagittal section of the brain where the main pathology is in the region of the circle of Willis at the base of the brain. There is a berry aneurysm here with intraluminal thrombus with fibrin formation. One of the main complications of berry aneurysm is the possibility of rupture with subarachnoid hemorrhage and sometimes intracerebral hemorrhage. Thank you.